you tend to use sometimes anatomical models and professional scientific models, and then very common, sometimes household items. Like in the Williams trial, you used a gift wrap tube for the trachea and a red balloon for the blood clot.
This is the trachea, that's the windpipe. And your windpipe is supposed to line up evenly on your neck. It's supposed to be what they call midline. You can see her windpipe is coming out here to the right and being pushed. This is called displacement. The doctors will talk about the windpipe being displaced. So this mass that's in Sandy's neck is not just pushing her windpipe forward, it's also pushing her windpipe to the right.
What goes into your thought process on when you're going to use, say, an anatomical model, professional model versus a common household item?
Well, you have to decide what the jury needs. In any presentation, the first question has to be, what does the audience need to do their job? So I try to reverse roles with a juror and think, if I'm sitting here, I'm seeing a bunch of people in suits and in this unfamiliar environment, and I'm a little confused. I'm maybe I have some anxiety. I'm concerned about doing the job correctly. So the question I ask as the lawyer is, if I was sitting in the seat of that juror, what would I want? And I would want things to be kind of simplified, make sure I understand what's going on. Because if it's confusing and muddied, then I'm not going to feel confident taking any action as a juror. So that kind of guides my thinking about demonstratives. And the case you were talking about earlier involved one of those beautiful people I've ever met, Sandy Williams, who went in for neck surgery. It's a relatively routine surgery. It was they call a fusion surgery. She has some degenerative or some old age problems in her spine, so she needed to go in and have some of the bone removed to give room for the spinal cord and relieve some pain. And very common surgery, has been around for decades. Well, she has the surgery and she's discharged and she's okay, but she develops a hematoma, which, as I mentioned earlier, is a large blood clot. And she develops it in her neck. And she comes back to the hospital, they do some x-rays, and they can see this hematoma in her neck, and it's actually pressing on her airway, her windpipe. But she's breathing okay, but she's got this large collection of blood and blood products, this hematoma in her neck. Well, you can describe it and maybe even make the jury completely understand it, but the hematoma became such a central focus of our trial that I decided to use a red balloon, water balloon, as a demonstrative of the hematoma. So starting from opening statement, I didn't use this in jury selection, but an opening statement, when I was telling the story of the case, I was able to use this water balloon about the size of your fist and show that it was up in this part of her neck and provide a strong visual reference for the jury. The water balloon hematoma was also very useful when we put up the radiology, the pictures of the x-rays. Well, you can see the x-ray, you can see where the hematoma is in terms of the outline on the x-ray. But it was helpful, and the jury gave us feedback on this later, but it was helpful to then put the hematoma up on the x-ray so that you can see, here's the hematoma, this is what we're talking about. And now you can see the compression of the airway caused by the hematoma. So the issues became, and this was the goal, but the issues and the facts became vivid in the jury's mind. The use of color was very deliberate. Hematoma is not bright red like a stoplight. It's got blood product and it's got blood cells, but it's also got plasma and other blood products. But of course, red is an aggressive color. It's a attention-grabbing color, and it's memorable. So the use of color is very deliberate when I'm preparing demonstratives to help teach the story of the case.